In PAH, early treatment choices don't just affect today, they shape what's possible tomorrow. For intermediate risk patients who need more than initial or current therapy, or refuse or are inappropriate for parenteral therapy, consider Orenitram. Orenitram shows a consistent dose-response relationship, meaning that with increased exposure, patients may see improved clinical outcomes. Knowing that PAH is progressive and may be unpredictable, your patient's needs can change. Orenitram's dose-response relationship gives you the flexibility to continue titrating to meet your patient's clinical goals. Recent studies have helped PAH experts identify the most effective dosing for their patients, such as targeting at least 9 milligrams as an initial total daily dose, which was associated with greater clinical improvement. Yet, adverse events left unmanaged may prevent patients from reaching the dose that provides the clinical response they need. Proactively managing side effects can help patients stay on therapy to reach an optimal dose. Flexible dosing with Orenitram can help meet your patient's unique clinical needs. For prostacyclin-naive patients, consider their risk profile. Initiate lower-risk patients at a low dose with slow-up titration to manage side effects while progressing toward their therapeutic goal. The titration kit can help you achieve this by steadily increasing your patient's dose. Patients who are ineligible for the titration kit may begin Orenitram with individual strength bottles. For higher-risk patients, consider parenteral therapy. For prostacyclin-experienced patients who are hemodynamically stable on long-term parenteral therapy, transitioning to Orenitram is supported by an established formula and dose calculator. Evidence from a peer-reviewed article supports that if patients on current therapy have reached dose limits or are at risk for discontinuation due to tolerability, they might be candidates for Orenitram. To help support these dosing approaches, Orenitram is available in 5 tablet strengths, allowing you to continue titrating to maximum clinical benefit while maintaining tolerability. Orenitram and REMODULIN may provide a strong foundation for patients with PAH who are not at low risk. For hemodynamically stable patients, clinical experience supports a transition from REMODULIN to Orenitram, which helps patients continue prostacyclin treatment. With flexible dosing and proven response, Orenitram and REMODULIN target PAH with a multimodal mechanism, allowing you to support your patient's treatment journey. See how Orenitram's dosing options can help you optimize PAH treatment at orenitramhcp.com/dosing-orenitram.
Orenitram Treprostinil Extended-Release Tablets. Indication: Orenitram is a prostacyclin mimetic indicated for treatment of pulmonary arterial hypertension, PAH, WHO Group 1, to delay disease progression and to improve exercise capacity. The studies that established effectiveness included predominantly patients with WHO functional class 2 through 3 symptoms and etiologies of idiopathic or heritable PAH, 66%, or PAH associated with connective tissue disease, 26%. Important safety information for Orenitram. Contraindications: avoid use of Orenitram in patients with severe hepatic impairment, child Pugh Class C, due to increases in systemic exposure. Warnings and precautions: abrupt discontinuation or sudden large reductions in dosage of Orenitram may result in worsening of PAH symptoms. The Orenitram tablet shell does not dissolve. In patients with diverticulosis, Orenitram tablets can lodge in a diverticulum. Adverse reactions: in the 12-week placebo-controlled monotherapy study and an event-driven placebo-controlled combination therapy study, adverse reactions that occurred at rates at least 5% higher on Orenitram than on placebo included headache, diarrhea, nausea, vomiting, flushing, pain in jaw, pain in extremity, hypokalemia, abdominal discomfort, and upper abdominal pain. Drug interactions: co-administration of Orenitram and the CYP2C8 enzyme inhibitor gemfibrozil increases exposure to treprostinil. Therefore, Orenitram dosage reduction may be necessary in these patients. Specific populations: Animal reproductive studies with Orenitram have shown an adverse effect on the fetus. There are no adequate and well-controlled studies with Orenitram in pregnant women. It is not known whether treprostinil is excreted in human milk or if it affects the breastfed infant or milk production. Safety and effectiveness of Orenitram in pediatric patients have not been established. Use of Orenitram in patients aged 65 years and over demonstrated slightly higher absolute and relative adverse event rates compared to younger patients. Caution should be used when selecting a dose for geriatric patients. There is a marked increase in the systemic exposure to treprostinil in hepatically impaired patients. Please see full prescribing information and patient information at www.orenitram.com or call 1-877-UNITHER, 1-877-864-8437.
REMODULIN treprostinil injection. Indication: REMODULIN is a prostacyclin vasodilator indicated for the treatment of pulmonary arterial hypertension, PAH, WHO Group 1, to diminish symptoms associated with exercise. Studies establishing effectiveness included patients with New York Heart Association, functional class 2 through 4 symptoms, and etiologies of idiopathic or heritable PAH, 58%, PAH associated with congenital systemic to pulmonary shunts, 23%, or PAH associated with connective tissue diseases, 19%. In patients with PAH requiring transition from epoprostenol, REMODULIN is indicated to diminish the rate of clinical deterioration. Consider the risks and benefits of each drug prior to transition. Important safety information for REMODULIN: warnings and precautions. Chronic intravenous IV infusions of REMODULIN delivered using an external infusion pump with an indwelling central venous catheter are associated with the risk of bloodstream infections, BSIs, and sepsis, which may be fatal. Therefore, continuous subcutaneous SC infusion is the preferred mode of administration. Avoid abrupt withdrawal or sudden large reductions in dosage of REMODULIN, which may result in worsening of PAH symptoms. Titrate slowly in patients with hepatic insufficiency because such patients will likely be exposed to greater systemic concentrations relative to patients with normal hepatic function. REMODULIN is a pulmonary and systemic vasodilator. In patients with low systemic arterial pressure, treatment with REMODULIN may produce symptomatic hypotension. REMODULIN inhibits platelet aggregation and increases the risk of bleeding. Adverse reactions. In clinical studies of SC REMODULIN infusion, the most common adverse events reported were infusion site pain and infusion site reaction, redness, swelling, and rash. These symptoms were sometimes severe and sometimes required treatment with narcotics or discontinuation of REMODULIN. The IV infusion of REMODULIN with an external infusion pump has been associated with a risk of bloodstream infections, arm swelling, paresthesias, hematoma, and pain. Other common adverse events, greater than or equal to 3% more than placebo, seen with either SC or IV REMODULIN were headache, 27% versus 23%, diarrhea, 25% versus 16%, nausea, 22% versus 18%, rash, 14% versus 11%, jaw pain, 13% versus 5%, vasodilatation, 11% versus 5%, edema, 9% versus 3%, and hypotension, 4% versus 2%. Drug interactions. REMODULIN dosage adjustment may be necessary if inhibitors or inducers of CYP2C8 are added or withdrawn. Specific populations. In patients with mild or moderate hepatic insufficiency, decrease the initial dose of REMODULIN to 0.625 nanograms per kilograms per minute of ideal body weight and monitor closely. REMODULIN has not been studied in patients with severe hepatic insufficiency. Safety and effectiveness of REMODULIN in pediatric patients have not been established. It is unknown if geriatric patients respond differently than younger patients. Caution should be used when selecting a dose for geriatric patients. There are no adequate and well-controlled studies with REMODULIN in pregnant women. It is not known whether treprostinil is excreted in human milk or if it affects the breastfed infant or milk production. Please see accompanying full prescribing information for REMODULIN. For additional information, visit www.remodulinpro.com or call customer service at 1-844-UNITHER, 1-844-864-8437.